Today we have Mrs. Nigel, who's a 55-year-old female who is seen in the emergency department. She is 5 days post-op her cholecystectomy. She is experiencing fever, fatigue, abdominal pain, and foul-smelling drainage at her incision site. She is being prescribed Zosyn, 3.375 grams every 6 hours to infuse over 4 hours with a drop rate of 10 drops per ml. So we are going to be giving her 4 drops per minute over the 4-hour period. The volume is 100 milliliters. So I'm going to gather my equipment. I am going to basically make sure, I'm going to check my expiration date. I'm going to check my medication. I'm going to make sure that there's no inconsistencies. I'm going to make sure that this is the right medication. This is what is prescribed. It is, Miss Nigel has no known allergies. I'm going to check her allergy. I'm just going to basically check her charts to make sure this is proper medication. Zosyn is an antibiotic. It is to treat infections that are caused by bacteria. Such as, we can have all different types of infections, stomach infections, skin infections, pneumonia, and, infections of that sort. It is very important to ask your patient if they are allergic to any penicillins, because it is in the penicillin family. Zosyn is given IV. So usually we will start your IV if you're here for the duration, which is usually 7 to 10 days. You will get your IV antibiotics here, or we will set you up with a home infusions if needed. You are to finish your complete medication as prescribed, even if you are feeling better. The Zosyn their bag should not be in room temperature after 24 hours. You are just to discard it if it is in room temperature for over 24 hours. Usually the dosage that doctors usually prescribe, it is a 3.375 grams, usually every 6 hours. So I'm going to wash my hands because we're going to get Mrs. Nigel started. So I'm going to wash my hands. I'm going to basically gather up all my supplies before entering her room, my tubing, my medication. I'm going to check my medication, check the expiration date. Anything that I would obviously need going into, I'm going to check her Mars. I'm going to make sure that everything is lining up to what I need. Now I'm going to come into Mrs. Nigel's room. Hi, Mrs. Nigel. How are you? I'm Christina. I'm going to be your nurse today. How are you feeling? Okay, so I have your antibiotic here. Let me wash my hands. I'll wash my hands. Mrs. Nigel, do you have, I know on your chart it says you have no allergies. Is that correct? Right, she has no allergies. Mrs. Nigel, can you tell me your name and your date of birth? Perfect, thank you. I would check that along with identification number. I'm gonna check her bracelet, also an identification number, date of birth, name, perfect. I'm gonna close the drawer. I'm gonna scan my medication, scan her medication. A lot of policies do 3 checks. So I would obviously check, I'm gonna check my rate factor, I'm gonna check my drip factor, I'm gonna check my dose, the medication, my patient, and I'm gonna make sure I have the right thing. Expiration date again, and all of that good stuff. All right, so I'm gonna access her IV site. Okay, it's looking good at this point because she has no continuous infusion going through. I'm gonna give her a flush. Always make sure you remove the air from the syringe. I'll give her a flush. While I flush, I will make sure to check to make sure that the IV is still in the position that it needs to be, right? So I'm gonna remove my gloves. I will wash my hands again. I'm gonna put a new pair of gloves on. All right, so I am going to close the clamp. At this point, I am going to blue cap. I'm gonna remove this plastic flap. I'm gonna use aseptic technique. I'm going to spike my medication. I'm going to twist it in, it's a nice little spike. Turn it till you get it in, right? I'm going to hang. So I already have my primary hanging lower, and then my secondary will be higher. I'm gonna squeeze the chamber, okay? I want the halfway full, or sometimes they do have a line. There is a line on this one, so we want it about halfway full, okay? So this will be connected. Excuse me. All right, so I'm going to take this cap off. I'm going to use alcohol swab. I'm going to disinfect the site, and then this port as well. We're going to, and I'm going to attach this into here. Okay. I'm going to open up the clamp here. I'm going to make sure on my IV pump, I'm going to make sure that my rate is correct. Okay, so my rate is going to be 4 drops per minute. We're going to infuse over 4 hours. Okay, so my 4 drops per minute, everything's good. I will connect all my tubing into my IV pump, right? Connect, make sure everything's set up perfect, and then I will hit run. Okay, I will come back, well, obviously before 4 hours, I will come and check on Mrs. Nigel to make sure that everything is okay. So then at this point, I am going to clamp, okay? Remove my medication. I'm gonna bring my primary back up. Mrs. Nigel is not, again, connected to any continuous dispose. She's not connected to any continuous fluids. So at this point, I would basically go, when I unclamp her, and put her HEP block on at this point, okay? Because she is HEP blocked. I will ask Mrs. Nigel how she's feeling, ask her if she needs anything at this point. No, she doesn't need anything, so I will now remove my gloves. Excuse me. Prior to coming back in, obviously I won't come in with gloves. So when I come back in to check on Mrs. Nigel, I will wash my hands again. I will introduce myself, well, reintroduce myself, wash my hands again, and just also let Mrs. Nigel know what I am doing. So I am going to disconnect her because her IV is complete. I will put gloves on at that point. Sometimes it's a little hard to do these because it's not in real life. But yes, hand wash every time you come into a room. You obviously put your gloves on. So, and then I just will let her be. Thank you.